let me have a show of hands. How many of you know someone who had the polio virus? Look around you. How many of you know someone who had cancer? Today, I'm going to tell you about making vaccines to treat a cancer that's caused by a virus. We've known how to screen for cervical cancer for over half a century, but it's still the third leading cause of cancer deaths in women worldwide. Cervical cancers are caused by a really common virus, human papillomavirus, HPV. HPVs cause more cancers than any other virus. Now, don't you be sitting there thinking, oh, that doesn't happen here in the States, because you'd be wrong. Basically, everyone's been exposed to HPV, men and women. I'm thinking most people in this room, actually, because you see, you get it as soon as you start having sex. I'm going to let you think about that. The reason why everybody has it is because in most people, it doesn't do a darn thing. You don't have any symptoms, and it can take your immune system a while to get rid of it. So in the meantime, God willing, you actually touch somebody, and you pass it on. If it was a gas, you'd say it was odorless, colorless, and tasteless, but still lethal. Every year, HPV kills almost 300,000 people. In women, most HPV cancers are in the cervix. In men, most HPV cancers are in the back of the throat. You want to know who gets it? Not what you're thinking, I bet. The incidence is skyrocketing in heterosexual men. They get it in their 40s and 50s, and you know something? We don't know how to screen for it. And by the way, if anybody in this room has a clue as to how HPV gets to the back of the throat of a heterosexual guy, please come see me after class. Now, most people's immune systems eventually clear the HPV, but some don't, and that's the risk factor for cancer. How big of a risk factor? It might surprise you to know, it surprised me, that the link between HPV and cervical cancer is bigger than the link between smoking and lung cancer. Okay, maybe you're sitting there thinking, isn't there already an HPV vaccine? There is, but it's a preventive vaccine. Preventive vaccines prevent infections. So that means you have to give it to someone who has never been exposed to HPV, someone who's never had sex. Let me tell you the difference between preventive vaccines and therapeutic vaccines. They both make an immune response, but a preventive vaccine prevents you from getting something. A therapeutic vaccine treats something you've already got. The way a preventive vaccine works is it makes proteins called antibodies. Antibodies recognize things that could hurt you, like viruses. Here come some viruses. When antibodies see their target, they glom onto them, and that prevents them from being able to get into your cells. But antibodies have no therapeutic effect. That means if you already have an HPV infection, the preventive vaccine is not going to help you get rid of it. Now, it turns out it's way harder to make a vaccine to treat disease. Here's why. A therapeutic vaccine makes a completely different kind of immune response. It makes something called killer T cells. Now, killer T cells go on a search and destroy mission in your body, hunting down abnormal cells. When a killer T cell finds its target, it kills it. Killer T cells have to be able to spot a needle in a haystack. A killer T cell is looking at something like this to spot its target. In an already virally infected cell, the virus is inside the cell. But sooner or later, bits of the virus are going to be displayed on the surface of the cell, and that's what the killer T cell is looking for. The killer T cell sees its target, it kills it. The same signal that tells a killer T cell to kill the cell also tells it to duplicate in case there's more targets around. Now, this next part of the story has to do with why it's so important to figure out why things didn't work. I'm a doctor. I take care of humans. When I did my first clinical trial, I tested a therapeutic HPV vaccine that my basic science colleagues had made. In mice, this stuff was amazing. It made huge immune responses and cured big, bulky HPV tumors. The problem was, it didn't do anything in my patients. We're talking bupkis, no immune responses at all. So I went back to my basic science colleagues and I said, yo, my patients didn't do like big mice. They said, well, that's okay, just keep doing what you're doing. I said, well, no. I want to know why it didn't work in my patients. They said, it's not your job to think about the immunology. Okay, I said, yep, what's my job? They said, get more patients. Okay, so that's just not going to work. But it also meant that I had to learn immunology, because at that point, I didn't know a T cell from my left cheek. The first thing I did was I went to a really high-powered tumor immunology conference. I got to tell you, I understood the titles of maybe half the talks. But my ignorance turned out to be a good thing, because I asked really simple questions, like a 5-year-old. Here's how it went. You've heard of a stitch in time saves 9? I decided, instead of trying to cure big, bulky cancers, that I would try to cure precancers, the lesion that leads to a cancer. I'd noticed that in some of my patients who I took to surgery to remove their precancers, the lesions had completely disappeared. Okay, that meant that in some people, a naturally occurring immune response could get rid of precancer cells. At first, I was really focused on trying to figure out what went into a successful immune response. But then I realized I should be trying to figure out what's going on in my patients whose immune systems couldn't clear it. I thought I was going to find killer cells that recognized HPV in my patient whose lesions went away. I thought I wouldn't find them in patients whose lesions didn't go away. Okay, that turned out to be not the case, because actually it was really hard to find HPV T cells in anyone. That told me that either I was looking for something that was totally irrelevant, or that I was looking in the wrong place. I had this light bulb moment. I thought, okay, Connie, the HPV is limited to the surface of the cervix. It's not in the blood. So why are you looking for immune responses in the blood? I decided to look in the cervix. My basic science colleagues told me I was crazy. I'm used to this by now, but this is what I saw. The precancer is on the left. The normal tissue is on the right. All those black dots are immune cells. You don't have to be an expert to see where the party is. Here's the problem. This dotted line is the bottom of the precancer. All of the immune cells are on one side of it, and the precancer is on the other side. So they did the search thing, but forgot to do destroy. It turns out that cancers suppress immune responses. So what's going on here is this precancer is cranking out proteins that turns the killer T cells into stoners. Instead of doing their job, they just sit in there. So once I realized this, the next clinical trial had intelligent design. Changed it in 2 ways. One, I'm using a much better vaccine, one that actually makes immune responses in humans. And the other is I'm putting a medication directly on the cervix. And this medication wakes up killer T cells so they can do their job. It's working. Let me show you. This is one of my patients' lesion before she got vaccine. Precancer is above the dotted line. This is what her cervix looked like after she got vaccinated. It's full of immune cells, and you see they're getting into the lesion. And you see these cells that are shrinking down away from the other ones? That's what a dying cancer cell looks like. Let me show you what's going on. Okay, the little cells are the killer T cells. The big cell is a cervical cancer cell. Watch. These T cells don't just stop with one cancer cell. After they're done with that, they go find some other ones. Last month, we reported results in a big clinical trial. We had tested a therapeutic vaccine made by a biotech company called Inovio. We tested it in women with HPV cervical precancers. We cured half the patients. For those of you who are sitting there scratching your head thinking, why is curing half the patients so good? What you need to know is that this had never been done before in humans. This trial was a stand-up double because it showed that it's possible to use a therapeutic vaccine to get a person's immune system to get rid of precancerous cells. And we have every reason to think that we can tweak the system to get the cure rates even higher. What about other cancers? It turns out that at least 20% of human cancers are caused by a specific infection. So that raises the possibility of being able to either prevent or treat disease by focusing a person's immune response to the infection. Other researchers who are studying other kinds of cancers are encountering similar issues. In a lifetime, the probability, the odds of having cancer are pretty high. In men, 1 in 2. In women, it's 1 in 3. A cancer diagnosis is terrifying. A lot of the time, it means having to have major disfiguring surgery. It means having to get treatments that make you really sick, like chemotherapy and radiation. Chemo and radiation make you sick because they don't just kill cancer cells, they kill normal cells too. What I've just shown you is a glimpse of how we could use something that's already inside you, your own immune system, to target abnormal cells and not normal cells. Let me have a show of hands. How many of you know someone who had cancer? How many of you know someone who had polio? I used to say, kind of in a half-joking way, that my goal in life was to put myself out of business. Until really recently, that was just a joke. And the other day I thought, it could happen. Thank you.